people that have no jobs, no insurance. Most of our patients have chronic diseases like diabetes, COPD, high blood pressure, all things that debilitate so that they can't go out and get a job and be productive.
Are you wheezing?
Yes, at night, really bad.
Lost my job and had to do bankruptcy and just had nowhere to go.
A lot of our patients are employed, but they're self-employed and they can't afford insurance, or they've recently been laid off. Sometimes it's difficult for them to afford their medicines, even a $4 pill. And when it comes to a choice between eating or taking your blood pressure pill, or feeding your kids, they're going to feed the kids and their family.
One man walked in and he was so nervous. I thought he was nervous. He was shaking all over, and come to find out he was having a health issue.
You've been taking your medicine?
Yes, ma'am. I had gone without health care for 4, 5, 6 years. Health started getting bad. I was self-employed, construction, that kind of thing. So if I don't go to work, I don't get paid. I was just kind of waiting for it to be over. I mean, I was miserable, broke, really didn't have anywhere to turn.
And I can remember exactly, April 2008, Lord laid upon my heart that I needed to do something in eastern Wake County because there just isn't anything.
A lot of people gravitate to Raleigh and they get a lot of help in Raleigh. There's a lot of money coming to Raleigh, but this area out here kind of gets forgotten.
We're a medical home for 106 patients, and we're now the medical home for 275 patients.
And it's a lot of people to go through with just one night a week that we're having a clinic.
And it's worse at night.
They're excellent doctors. The nurses are excellent. The people in the front are excellent. I'm just blessed I found them.
All the volunteers here do it for nothing. They do it because they care about people and want to see people treated and taken care of.
And a lot of them, I know, have personal struggles their own self. And I think that's one reason they make such good helpers, volunteers, is because they're so empathetic.
We're a family. It's the only way I can put it. We have 2 doctors. One works for a VA and then one works for hospice. And they work hard all day seeing patients, and yet they come in here at 6:30 at night, and sometimes we don't leave here until 10 or 11 o'clock at night. We
actually have picked up several people that have had cancers that they've kind of ignored or put off. Maybe they were afraid, or they're afraid they're going to run up big bills, and we've been fortunate enough to get them to specialists that have treated them for free or even very inexpensively.
When folks are doing what they do on their own time, it is so much different. You feel like it's the only job you can do is to do everything you can to do what they tell you to.
If anybody ever asks me, it's God's and I'm just a proprietor. It's all His. We would not have anything. We would not be where we are. We would not receive the grants if it wasn't for God's graces. We truly believe it here. We are a clinic of individuals of faith, and our faith is in Him.
Lord puts us here to witness to others and to be an example to them and to help them as much as we can, because we are His extension.
You know, call Leona my angel. I have no doubt if the clinic hadn't been here when it was, and I hadn't found out about it, I wouldn't have lasted long. I can't say enough for what they do here.
To me, it's a blessing. I mean, God had to put them here to help these people, because I know there's a lot more people that are in worse shape than me, that need it more than me. And without them, they're not going to get it.
And we just hope that in the future we can get more people to volunteer and more people to help us do this work, help us to meet the needs.
We have people who sometimes just give us what they have. It may be a couple dollars or something, but they're just so happy to come here and have a place to go that they give us, a dollar or two here and there, and that's appreciated. But a dollar or two here and there doesn't keep the doors open.
We're going to be here as long as God will keep us open. And he's the one that's going to be able to do that, because we're going on our faith that the people out there are going to have the kind hearts to donate the funds to help keep us going.